Hey everyone, and welcome. Especially if you're a nursing student, you are exactly where you need to be. In this clinical explainer, we're going to break down everything you need to know about burn trauma. I'm talking about the stuff you'll actually use on the floor. All right, let's jump right in. So, burn injuries are a huge public health issue, not just here, but all over the world. And for us, as future clinicians, right, the first step to getting good at prevention and treatment is really understanding the data. So that data, that's our starting point. It's the foundation for everything else we're going to cover.
All right, let's kick things off with a number that's, well, it's pretty staggering. 500,000. Yeah, 500,000. That's how many people in the U.S. alone need medical care for burns every single year. It just goes to show you how constant and significant this is in our healthcare system.
Okay, so first up, let's really get a handle on the scale of the problem here. We're going to look at the numbers, both here at home and around the world, to see just how big this issue is.
And believe me, this isn't just a U.S. problem. Globally, burns rank as the fourth most frequent type of injury. Think about that. They're right up there with the other major traumas you're learning about. It just really drives home how crucial it is to get a solid handle on burn care, because you're going to see it no matter where you end up practicing.
So with a problem this big, how have we responded? That's what's so fascinating. We're going to dive into the incredible progress we've made both in preventing burns and in the amazing, specialized care that has literally saved countless lives.
Okay, so here's some good news. Even though that 500,000 number is huge, the number of severe burns has actually been going down in the U.S. So that brings up a question for you. Why do you think that is? What have we been doing right? Just take a second and think about what factors could lead to a decrease like that.
Okay, got your answer? If you were thinking along the lines of public health and safety, you absolutely nailed it. It's not just one thing. It's a victory on multiple fronts. We've got better education out there about preventing burns in the first place. We've built more specialized burn centers. Consumer products are just plain safer now. And, of course, there are much stricter standards for safety in the workplace. All of these things have come together to make a huge difference.
Let's double-click on that idea of specialized care for a minute. So right now, in the United States, there are 128 ABA-verified specialty burn centers. And having these centralized hubs is absolutely key. It means all the expertise, the high-tech gear, and the resources are all concentrated in one place, which makes them incredibly effective.
And if you want to see just how effective they are, just look at this number. The survival rate in these specialized centers is a jaw-dropping 96.8%. I mean, that is just incredible. It's proof of what these dedicated multidisciplinary teams can do. They've turned an injury that was almost always fatal into something that is overwhelmingly survivable.
All right, so we know that care is amazing. But who are the patients walking through those doors? Getting a clear picture of the patient profile is so important for us, right? It helps us target our prevention efforts and tailor our treatment. So, what does the data tell us?
Well, first off, there's a really clear difference between genders. Look at this. Males make up 68% of patients in these burn centers. That is more than double the rate for females. That's a really important piece of the puzzle when we're thinking about who's most at risk.
And when we look at the ethnic breakdown of patients, we see that 59% are Caucasian, 20% are African American, 14% are Hispanic, and about 7% fall into other categories.
Okay, here's another question for you. And this one is absolutely vital for patient education. I mean, if we're going to teach people how to prevent burns, we have to know where they're happening, right? So take a guess. Where do most of these burns actually happen?
And the answer? Well, it's not even close. It's the home. A whopping 73% of burn injuries happen at home. Work is a very distant second at just 8%. Honestly, if you only remember one number from this whole explainer, make it that one, 73%. It tells us exactly where we need to focus our prevention and education efforts.
Okay, so we've covered the who, the what, and the where. Now it's time to get into the really nitty-gritty science, the why and the how. Let's talk pathophysiology. We're about to explore the body's incredibly complex and frankly terrifying response to a major burn.
Okay, so what's the very first thing that happens in a severe burn? At its core, it's the loss of our physical skin barrier. You know, we forget that our skin is our largest organ, and its number one job is to be our suit of armor. When that armor is gone, the patient is immediately facing two huge threats. First, massive fluid loss, and second, and this is critical, they're wide open to overwhelming infections that can spiral into systemic sepsis in no time. And that loss of the skin barrier, it sets off this dangerous cascading chain reaction in the body.
First, you lose the skin barrier. That triggers a massive body-wide inflammatory response, a cytokine storm. This leads to what we call distributive shock. Basically, all the blood vessels dilate and become super leaky. Your blood pressure tanks and your organs aren't getting enough oxygen. And if we can't stop that progression, the final stage is multiple organ dysfunction syndrome, MODS, where the organs just start shutting down, and that is often the end of the line.
All right, we're in the home stretch. Let's wrap up with some key numbers that you absolutely have to know for your exams and, more importantly, for your practice. These are the risk factors that are directly tied to a patient's chances of survival.
So, which age group is at the highest risk? It's young adults. Specifically, people between the ages of 20 and 29. That's a really important thing to keep in the back of your mind when you're thinking about patient counseling.
Okay, and here's a massive clinical benchmark. In an adult patient, once a burn covers more than 40% of their total body surface area, or TBSA, that's when the mortality risk skyrockets. So why 40%? Well, that seems to be the tipping point where that massive inflammatory response and the huge fluid shifts just become too much for the body to handle, even with the most aggressive medical care. It's a major, major factor in prognosis.
And this number, it really brings us full circle. Remember how we said most burns happen at home? Well, tragically, that's also where most of the deaths happen. About 2,745 people in the U.S. die every year from fires in their own homes. It just hammers home, again, how badly we need to be talking to our patients about home safety.
But it's so important to remember that for these patients, survival is just the beginning. This quote says it all. The impact of a burn can last a lifetime. We're talking about functional changes, aesthetic changes, but also the deep, deep psychological trauma. All of it impacts their mental health and their quality of life for years, long after they've left the hospital. And caring for that part of the patient, that's a huge part of being their nurse.
Okay, so I want to leave you with one final thought, a challenge really, that I want you to carry with you into your nursing practice. You know that number now, 73% of burns happen at home. So what is the single most important piece of prevention advice you are going to share with your patients? Really think about that, because that one little conversation, it might just be the thing that saves someone's life.